Kentucky has many strengths, but among our weaknesses is the dismal collective health of our people. And let's don't sugarcoat this. Dismal is an accurate way of putting it. As we all know, Kentucky ranks among the worst, if not the worst, in a host of categories relating to health. As we also all know, those rankings have changed very little through the years. We've made some incremental improvements, but incremental improvements are not getting us to where we need to be. We need people to recognize the large and negative consequences of our poor health. And we need people willing to do the sustained hard work of improving that health. So today I'm announcing a wide-ranging initiative called Kentucky Health Now that will use multiple strategies over the next few years to improve our collective health. These strategies will fall into 4 categories: executive branch action, legislative initiatives, public-private partnerships, and most importantly, steps that will build upon the great success we've had in enrolling more Kentuckians in health care coverage. You've seen the big numbers associated with Kentuckians accessing coverage for the first time through Connect, Kentucky's implementation of federal health care reform. Those numbers, folks, those numbers continue to climb. In fact, we have reached, as of today, 244,000 Kentuckians who now have affordable health coverage. What that means is that nearly 250,000 of our friends and family now have access to things like cancer screenings, drug treatment, and pediatric dental visits. Those aren't just numbers. They represent saved lives and real improvement in people's health. The Kentucky Health Now initiative that we're announcing today will set specific goals for positive health outcomes that will help hold state agencies accountable for meaningful, measurable progress. And it will challenge local governments, businesses, schools, nonprofits, and individuals to join that effort. Specifically, as you can see over here on the board, Kentucky Health Now targets 7 major health goals to be met within 5 years by January 1, 2019. What are those goals? 1, in the area of health insurance, we want to reduce Kentucky's rate of uninsured individuals to less than 5%. The link between access to affordable health care and good health is clear, it's direct, it's indisputable. Obviously, as I've stated, we are already making great strides in this area through the state-based health benefits exchange and the expansion of Medicaid to cover more of Kentucky's working poor. The second goal, in the area of smoking, we want to reduce Kentucky's smoking rate by 10% over the next 5 years. Smoking is the single biggest factor negatively affecting the overall health of Kentuckians. Our high smoking rates contribute to nation-leading rates of heart disease, respiratory illnesses, and other chronic diseases. As you all know, we have smoke-free legislation pending in this legislature. We need to pass that legislation right now. Three, in the area of obesity, we want to reduce the rate of obesity among Kentuckians by 10% over the next 5 years. The Commonwealth of Kentucky ranks 40th in obesity, 46th in physical activity, with a shocking 31.3% of adults considered obese. Like smoking, obesity is a factor that negatively impacts health in a multitude of ways. Number 4, in the area of cancer, we intend to reduce by 10% the number of cancer deaths in Kentucky by January 1 of 2019. With nearly 9,500 cancer-related deaths every year, Kentucky ranks 50th, dead last right now. Number 5, in the area of cardiovascular disease, we've got the same goal, to reduce the number of deaths by 10% over the next 5 years. We rank 48th in the nation with more than 12,000 deaths a year. Number 6, in the area of dental decay, we intend to reduce the percentage of children with untreated dental decay by 25% and increase adult dental visits by 10%. The poor dental health of Kentuckians has not only subjected this Commonwealth to ridicule over the years, but has also had a detrimental impact on our school children, our workforce, and our families. The numbers are terrible. We rank 41st in annual dental visits, 45th in the percentage of children with untreated dental decay, 47th in the percentage of adults missing 6 or more teeth. We can do better. And number 7, in the area of drug addiction, we intend to reduce deaths from overdose by 25% and reduce by 25% the average number of poor mental health days of Kentuckians. Again, we're making progress in this area with increased access to substance abuse treatment and a more aggressive approach to prescription drug abuse. Each of these goals is supported by multiple strategies, as many as a dozen in each area. For example, we will support legislation creating a Good Samaritan rule for individuals seeking overdose treatment or assistance for others. We'll create public-private partnerships to increase to 75% the number of students in grades 1 through 5 receiving twice-a-year applications of dental fluoride varnish. We will increase opportunities for recreation and exercise by certifying 10 new trail towns through the Kentucky Office of Adventure Tourism by the end of 2015. And we will increase screening rates for colon, lung, and breast cancer by 25% through the Affordable Care Act in accordance with evidence-based guidelines. Now, there's a long list that has already been passed out here detailing more of those strategies under each of these goals. And we expect to develop even more strategies as state agencies and private partners become engaged with the Kentucky Health Now initiative. Now, to hold this administration accountable for meeting these goals, I'm creating the Kentucky Health Now Oversight Team, which will meet quarterly and report to me progress every 6 months. It will be chaired by Lieutenant Governor Jerry Abramson. Its vice chair will be Dr. Stephanie Mayfield Gibson, Commissioner of the Department of Public Health. Information about Kentucky Health Now, Kentucky's health statistics, the oversight team, and more can be found on the Office of the Governor's website. Finally, let me say this. The importance of good health cannot be overemphasized. A person's health and the collective health of our people affects every aspect of our society. That includes worker productivity, the attractiveness of Kentucky to prospective businesses, financial security, school attendance, health care costs, state revenues, and our very quality of life. Cars don't get built when sick workers stay home. Children don't learn when they're in bed with a cold, asthma, or crying from infected gums. And retirement doesn't provide the fun, peaceful, and rewarding lifestyles that our seniors have spent decades working toward when they're suffering from cancer, COPD, or untreated diabetes. For making Kentucky stronger and the lives of our people better, we must become healthier. And today we set specific goals and strategies for accomplishing this critical mission. Thank you. Next, let me call upon Lieutenant Governor Jerry Abramson.
Thank you, sir. You know, I think the governor's made the challenge very clear. We have significant problems in the Commonwealth of Kentucky as relates to health. And the governor, as he's been reviewing everything to create a state where we can attract more investment, create more jobs, clearly understands that there are a lot of parts that have to come together to make that successful. Whether it's a tax code that is responsive to economic growth, or whether it's ensuring that there's educated, productive, and skilled workforce ready to go to work. And the third aspect is to ensure that health care is there and is being provided. And we inside state government and the folks who are already in the business throughout the Commonwealth, be they educators, be they nonprofit, recreation folks, universities, community colleges, right all the way down to the preschool programs, all working together, look for opportunities to implement the strategies that you see in the materials that we've submitted. An awful lot of work has gone into this from Secretary Haynes' cabinet, and my vice chair slash co-chair slash friend, the leader of the healthcare effort here, Dr. Mayfield, will be my vice chair, and we'll be working through this with the internal group made up of the cabinet secretaries that you see here and or their representatives to ensure that we're doing everything we can within the context of what we control to be able to move all these strategies forward. At the same time, if I've learned anything in the experience I've had in community involvement, we've got to reach out to an awful lot of other organizations that are already actively involved in understanding that these kinds of issues affect each and every one of us. When the governor and I traveled around the Commonwealth rolling out Connect, it was very clear, whether we're in northern Kentucky or in the mountains, whether we're in western Kentucky or down south central or in Louisville or in Lexington, that citizens understood health care played a major role in the quality of life of the community. With they mayors, county judges, magistrates, city council folks, state reps or senators, they clearly understood that the health of their community played a major role in the quality of life that they could provide and in the attraction opportunities for economic growth. We're joining with them, the governor's leadership. The challenge is put there before us. We'll have metrics. It'll be very clear. We'll be meeting twice, every other month? Every other month? 3 months. Every 3 months, and bring the document to the governor and make it public in terms of twice a year so that everybody can follow exactly what we're about and where we're going. It's a challenge. It needs to happen, and we're looking forward to, with the governor's leadership and the members of the cabinet, to be able to reach the goals that the governor has challenged us to reach. Thank you very much. Thank you. Thank you, sir.
All right. Are there questions?
Well, Governor, you're really talking about changing people's behavior, aren't you? You've got this, your Secretary of the Cabinet, a social worker by trade. I'd like to have her address just how difficult it is to change people's behavior.
Thanks, Al.
And here's Audrey.
I could tell you had the pain of an unexpressed thought.
Thanks. Well, you know, the interesting thing about this initiative is that I think Connect has provided folks with access and a lot of opportunity to get good health care. Now we just have to lead them to the waters and make them drink. Part of it is showing people how to get, how to change culturally, going from emergency rooms as their primary care docs to primary care docs in outpatient clinics. Part of it is getting people to get those annual screenings. And part of it is just in our communities, each and every one of us, taking it upon ourselves to take a walk in the afternoon, hopefully when it's above 15 degrees, and to drink more water. I mean, we all know what we need to do. And so what we have to do is bring along our children and our neighbors to do that and make the healthy way really being the only way. So we have to put peer pressure on each other. It's not going to change overnight, and it is going to take not only community-based organizations, but it's also going to take the health delivery community. Our healthcare providers have to become educators even more than ever. And so our insurance carriers, our managed care organizations, I hope many of them are here today. If we could just get the people that are in this room today to commit that their members and their associations are going to step it up and do their part in educating all of our citizens about healthier habits and lifestyle changes, I do believe that we will be able to reach and possibly even surpass the governor's goals. I'm quite confident. And as a social worker, it takes repetition, to your point, Al.
Governor, is passage of the smoke-free bill within your list of strategies?
On the smoking rate, yes. It's one of the strategies.
What about raising the cigarette tax?
That's another one of the strategies in your list. Yep.
What if those things don't pass? How do you hold the General Assembly accountable?
Well, number one, we're going to work hard to try to make sure they pass. And if they don't pass this session, we will be back in 2015 and working to pass them in that session. And I believe that you've seen those issues growing in popularity all the time. Many of these issues are difficult to address, and it takes a period of time and education before you finally get there. But I've seen a lot of strong movement in both of those areas. As a matter of fact, we've raised the cigarette tax once since I've been governor, and I'm hopeful that we can do it again before I go out as governor. But there's a number of other issues and a number of other strategies under reducing the smoking rate that are there to do also. Not every one of these strategies is legislatively driven. As a matter of fact, there may be 1 or 2 out of 10 strategies under each one of these goals that may require some legislative action. A lot of these strategies require executive branch action and partnerships between the public and private sector in our communities.
Is there a price tag on how much the strategies as a group might cost, if they cost anything?
If you review these strategies, you will see that for the most part, these are efforts that state government can take with local governments, with school boards, with colleges and universities, with communities, both the public and private sectors in our communities, with very little cost to anybody. It's the educational effort that the Secretary pointed out that is so important in the long run. You know, we now, for instance, have people who are going to have health care coverage, and that coverage is going to be comprehensive. It is going to cover so much more than many of these policies used to cover. And for the first time, these people are going to be bringing their children in and getting immunizations and doing the routine doctor visits. That will have the adults in there with those children, and it will give our medical community even more of an opportunity to educate parents as we go along and educate those children as we go along about the importance of prevention and wellness. I can point to any managed care organization or any of our insurance companies in the room, and they'll tell you that's where health care is going and has to go if we're going to maintain some control of the cost situation in health care. We have got to have much more prevention and wellness worked in to these strategies, and that's what the new coverage is aimed at under all of these plans, and that's where we're moving.
Under the cancer section, it says you're going to be providing a few $1 million in matching funds for cancer screenings. Is this money that's been appropriated in your budget proposal?
Yes, we appropriated money during the last budget, and in my budget proposal for the next 2 years, that money is recommended.
Can you tell us about the split in that 244,000 now enrolled in Connect? What percentage of that
Is it still about 1/4?
It's about 75%
It's about,
Medicaid.
right. It's about 70. It's still about 75% expanded Medicaid, 25% qualified health plans. The number of folks under 35 is in the 40 percentile range, which is very encouraging. And you know, we started out signing up people at the rate of 1,000 per day. We just knew that couldn't last for very long, and it didn't. Now we're signing up people at 1,700 per day. That's how exciting this is. You know, there is a pent-up demand in Kentucky for affordable health coverage. I mean, it's obvious that thousands and thousands of our people want this kind of coverage, and you know, the only proof you need is in the numbers. They're showing up in droves.
What are the prospects of having expanded gaming with the session more than halfway over?
Well, let's get through this, and then if you all want to ask another question, we can.
One other question on health. There is evidence that if you provide access to health, that people will take advantage of it, but there are also some studies, you know, one in Oregon, for example, that showed you really didn't improve people's health status that much by putting them on Medicaid. You dispute those studies? How sure are you that that's really going to work?
I'm highly confident that the more people we get covered with good health care coverage, long term, the better the health of Kentucky will be. That one Oregon study you point to was a study done after 2 years.
Right.
And, you know, that we all know that this is a long-term process, and that, you know, a 2-year period is not an adequate period of time to really make a judgment about an issue like that. You really need to look 10 years out and 15 years out and 20 years out. You know, this is one of these things that many governors don't get too involved in, because, you know, a lot of governors say, if you can't put my name on it at the end of 4 years, why do I get involved in this? Well, this is going to make a difference in the next generation. It's not necessarily going to make a difference 2 years from now or 3 years from now. It's in the next generation that you're going to see such a huge change in Kentucky's health status. Okay, thanks.
Move it on.